Hello, this is Dr. Morris. I'm going to do a review for the material that covers Exam 2 for Anatomy and Physiology 1. I'll start with the lecture portion of the exam, and then I'll go to the review for the lab portion of the exam. For the lecture portion of the exam, remember the material we're going to be covering will cover aspects of histology and the integumentary system. To start off with, you should be familiar with the different types of epithelium, specifically simple columnar epithelial. There are specific organ structures that are lined with simple columnar epithelial tissue, and you should be familiar with those structures. I'll give you one example. The lining of the stomach is covered with simple columnar epithelial tissue. You should be familiar with the functions of the pancreas. Remember, the pancreas is an endocrine and an exocrine organ, and you should be familiar with those terms. What do I mean by exocrine? What do I mean by endocrine? You should be familiar with the secretions that come from the pancreas. The secretions are important in carrying out both digestive functions. Also, when we talk about an endocrine function, it's also important in the regulation of glucose in the body as well. You should be familiar with those secretions. Remember, some of the secretions are delivered through a duct system. Other secretions are delivered through a ductless system. And this refers to both how the enzymes of the pancreas are released and how the hormones are released. You should be familiar with dense connective tissue. You should be familiar with the histological appearance of that tissue and also the different types of structures that are involved are the types of structures that would contain dense connective tissue. You should be familiar with the differences in the following types of tissue: connective tissue, epithelial tissue, as I discussed a little bit earlier, neural tissue, muscle tissue, and osseous tissue. Now, not only should you know a good description of each of those types of tissue, but you should also be able to recognize them histologically if I would present a slide. Of course, I'll go over that more when I review the laboratory portion of the exam. You should be familiar with the types of structures, such as ligaments and tendons, and their general appearance. You should be familiar with the term areolar tissue and reticular tissue. Remember, there's dense regular connective tissue and dense irregular connective tissue. You should know the difference between those two. You should be familiar with the structures that contain hyaline cartilage. That hyaline cartilage, as you may be familiar with, is a type of connective tissue. We see it as supporting structures, such as supporting things, structures in the airway, connections between the ribs and the sternum. And so you should be familiar with hyaline cartilage, again, the histological appearance, and then also where it's located in the body and a good description of it. You should be familiar with the following terms: metaplasia, dysplasia, anaplasia. You should be familiar with the term inflammation. You should also be familiar with the term metastasis. Other types of epithelial tissue you should be familiar with. I've already mentioned simple columnar epithelial tissue. Should be familiar with another type of epithelial tissue referred to as transitional epithelial tissue. You should know where transitional epithelial tissue exists. You should be familiar with the following cell types: macrophages, adipocytes, mast cells, melanocytes, and fibroblasts. Another type of epithelial tissue you should be familiar with is simple cuboidal epithelial tissue. You should know a description of simple cuboidal epithelial tissue. Should also be able to tell me some structures where you would find simple cuboidal epithelial tissue. You should be familiar with the term loose connective tissue and dense connective tissue. You should be familiar with the different types of muscle tissue. Skeletal muscle tissue should be able to give me a good description of that, and obviously where you would see skeletal muscle. Cardiac muscle. Then the name tells you where you should be able to identify or where you should be able to see cardiac muscle, but there are some differences between the muscle pattern of skeletal muscle and cardiac muscle, and you should be familiar with that. You should also be familiar with smooth muscle tissue as well. I believe I already said, but I'll repeat it again. You should be able to give me a good description of tendons and ligaments and what type of tissue forms tendons and ligaments. You should be familiar with some of the structures, such as these are surface appendages, villi and microvilli. You should also be familiar with the junctional complexes. You should be familiar with some of the intracellular structures that we actually have gone over in the previous exam material, such as mitochondria, cilia, the Golgi complexes, the endoplasmic reticulum, all intracellular structures. You should be able to differentiate by not only description, but also identify the types of junctions between cells. I alluded to that just a little bit earlier with junctional complexes. Specifically, you should be able to identify gap junctions, tight junctions, desmosomes, and hemidesmosomes. These are specific types of connections between neighboring cells. You should be able to give me a clear definition of those or recognize a clear definition of those structures. Should be able to tell me the difference between voluntary and involuntary muscle. You should also be able to give me a good description of or definition of substance referred to as chondroitin sulfate. This is abundant in a particular type of tissue, and you should be familiar with that. You should be able to give me a good definition of melanocytes, keratinocytes. You should also be able to give me a good description of the various types of skin cancers. And you should be familiar with the various types of skin cancers. I'll give you examples: basal cell carcinoma, malignant melanoma, and squamous cell carcinomas. Should be able to identify and differentiate between those three different types of skin cancers. Should be familiar with the condition known as vitiligo. You should be familiar with the different types of pigments that are in the skin. You should know where these pigments are located in the integumentary system. The primary pigments are keratin and melanin. Should be able to give me a good description of those. You should be familiar with the difference between Marroquin sweat glands and apocrine sweat glands. You know, each of these sweat glands have different types of secretions. You should be familiar with the secretions there. Some have chemical products in them that are important in protecting the skin from assault by different types of bacteria. You should be familiar with that. You should also be familiar with the different types of cell layers that are involved in the integumentary system. Your book has a very good illustration of that, and you should be familiar with that illustration. It shows each of the surface areas, shows the layers of the integumentary system, beginning with the surface layers and the different stratum layers, ending at the most inferior portion with the dermis. So you should be familiar with that. I know that many of you have asked that question on some of the emails I've received, so should be familiar with those specific types of structures. You should be familiar with what goes on in each of those particular layers. Remember, these layers are of dividing cells, so you should be familiar with what activity goes on in the stratum corneum, the stratum germinativum, the stratum granulosum, the stratum lucidum, the stratum spinosum, and you should be familiar with the activities that go on in each one of those layers. You should be familiar with burns. And the integumentary system obviously can be damaged by a thermal injury. Should be familiar with the difference between the first, second, and third degree full thickness type burns. You should be familiar with the types of injury that occurs at those layers, a good description of that, and typically what treatments are required, particularly with those full thickness type burns. You should be familiar with a disease condition referred to as rickets. You should know what causes rickets and obviously what should prevent rickets, how it's treated. You should be familiar with the terms sensible perspiration and insensible perspiration. You should be familiar with the term referred to as lines of cleavage, and how that relates to the integumentary system. You should be familiar with the term dermatitis. Should be familiar with what layer of the integumentary system is involved in dermatitis and a good definition of dermatitis. You should be familiar with the protein elastin and the importance of the protein elastin in the integumentary system. You should be able to give me a good definition of cyanosis. What causes cyanosis? How do you identify it in a particular patient? You should be familiar with the term jaundice. Give me a good definition of jaundice. Should be able to give me a description of how jaundice appears in the integumentary system, and maybe even what causes jaundice. You should be familiar with two important acids in the body, lanolinic acid and linolenic acid. These are very important in the body. They are considered to be fatty acids, and you should be able to give me the importance of fatty acids in the body. There are also certain cations that are important in the body: sodium, magnesium, calcium, potassium. You should be able to give me which of those particular types of cations are important in muscle contraction, nerve conduction, and also in blood clotting. You should be able to tell me the major cation, both in the cytoplasm, which is inside the cell, the major cation on the outside of the cell. You should be able to tell me what's the most important anion, both inside the cell and the cytoplasm and outside the cell. You should be able to give me the difference between high-density lipoproteins and low-density lipoproteins. You should be able to give me a good definition of metabolism and be able to recognize the definition of metabolism. You should be able to give me the importance of some key vitamins, vitamin A, vitamin C, and vitamin K, and what these vitamins are responsible for in the body. You should be able to tell me the difference between the following types of processes in the body: metabolic acidosis, respiratory acidosis, metabolic alkalosis, and respiratory alkalosis. Basic definitions of each, maybe some disease conditions as it relates to respiratory acidosis, disease conditions as it relates to metabolic acidosis. Should be able to tell me a good definition of acid, a good definition of an alkali, good definition of a buffer, and a good definition of electrolytes. And I've gone over some of the more key electrolytes previously. Should be able to give me a good definition of hypoventilation and which one of those metabolic processes that I discussed earlier, respiratory alkalosis, respiratory acidosis, metabolic alkalosis, which one of those conditions relate to hypoventilation and why. Should be able to give me a good definition of the compensatory mechanisms involved in regulating the acid-base system in the body. Now, that's the material that will be covered on the lecture portion of the exam. Let me move to some of the material that will be covered on the lab portion of the exam. These slides basically are taken from your, from course documents on the lab portion of the course. I would expect you to identify simple cuboidal epithelial tissue. Now, again, this picture, and you would pretty much have an arrow that would point to this particular type of cell type, and then I always will give you a description of the type of tissue that you're looking at. For example, I may say this is the collecting duct of the kidney, identify this particular cell type, and I would expect you to say simple cuboidal epithelial tissue. Now, conversely, I may also say this is simple cuboidal epithelial tissue, identify what type of organ system would you typically see that at, and one of your choices would be the collecting duct of the kidney. So the questions will be very straightforward. That's not a good picture that I would show for the purposes of the exam. Now, this is a picture of simple columnar epithelial tissue. And again, I would give you a description of what type of tissue this is located in. And this is the cell type. Simple columnar epithelial tissue, obviously the prominent nuclei, long rectangular type of cell tissue, typically lining the distal process. This is a better picture of simple columnar epithelial tissue, and this is the classic picture like what I would show on the exam. Pseudostratified columnar epithelial tissue, remember lines of respiratory tract, see the surface appendage, the cilia that are located here. Again, a classic picture that I would probably put on an exam. I would ask you to identify the cell type, and then I would also ask you to identify the surface appendage. Again, I would base that upon the type of tissue where it's located at. So I would tell you the tissue, you would identify the cell type. This is not a good picture that I would not give this one for an exam. For transitional epithelial tissue, I typically would tell you this is an organ, has a specific type of epithelial tissue. I would identify it as a urinary bladder. Then I would expect you to be able to tell me the type of tissue that's located there. Transitional epithelial tissue, very typically located in the urinary bladder. So if you saw a urinary bladder, you should immediately, light should go on that this is transitional epithelial tissue. Again, this is a classic picture that typically is used for the purposes of an exam. Stratified squamous epithelial tissue. Again, I would give you a description. Where is it located at? The lips are an excellent example of where you'd see stratified squamous epithelial. And you see the stratification, how the cells are stacked upon each other. Again, the lips are a classic location for this tissue type. Stratified squamous epithelial also located in the vagina. And again, classic picture, classic description or tissue structure that would have stratified squamous epithelial tissue. Now, again, stratified squamous epithelial tissue located on the dermal surface. Again, you can see some different appearances here on the surface. This is basically either callus or stratified tissue as it's falling away. I'm sorry, I jumped ahead there. Again, stratified squamous epithelial tissue as seen in the body. Now, this is the stratified epithelial tissue. And this is basically the thick, this area of cells, as you can see, are held together tightly by the junctional apparatuses here, but this tissue structure here on the surface of the stratified squamous epithelial tissue. Some melanocytes here. Again, I may ask you to identify melanocytes in the skin, and that's the pigmented portion of the tissue. Nerve cells, nerve tissue, skeletal muscle, the striations noted here. Notice the parallel bundle, the peripheral location of the nuclei, classic for skeletal muscle. Would expect you to be able to identify that. Smooth muscle, I'd have to give you a description of that because smooth muscle in some of the slides I recognize kind of look like stratified squamous epithelial tissue. So I'd have to tell you what the location of this structure is. Perhaps this is a muscular structure lining a blood vessel, muscular structure lining the GI tract. that should tell you that it's smooth muscle versus any other type of structure. Cardiac muscle, again, striations, yes. This intercalated disc, I would expect you to be able to identify those. Prominent nuclei, not peripherally located as you saw in the skeletal muscle. And again, you see the branching of the muscle pattern here as well. That's very typical of cardiac muscle, not typical of skeletal muscle. You do see striations similar to what you saw in skeletal muscle, but obviously in comparison, you see different striations in parallel bundles of muscle versus cardiac muscle. They're not parallel, they're branching, very prominent nuclei, and of course the intercalated disc. Classic picture seen on an exam. I asked you to identify this structure and the disc. You should be able to tell me what's the importance of the intercalated disc as well. Haversian canals, bone tissue. Know the importance of the Haversian canal. Classic picture that's shown on an exam, Haversian canal. Look at the lamella. Dense, regular connective tissue. Again, you need a little bit of a definition here. Can sometimes be confused with skeletal muscle, but I doubt it because of the staining pattern. It takes a particular stain to stain dense, regular connective tissue. Reticular tissue of the liver, again, another classic picture that's shown for an exam. Adipose tissue. Remember, the adipose tissue is here. Doesn't take up a stain very well. This adipose tissue surrounding blood vessels. This actually has smooth muscle here in the blood vessel of an artery, and this is the vein. And when you do A&P2, we'll go over the structure of arteries and veins a lot more. But this is what I'm actually asking to identify, the adipose tissue here. And then in the integumentary system, I've already explained to you the importance of being able to identify this structure. This is the structure of the epidermis, beginning at the surface, extending down through the stratum layers. You have several questions on the lab exam for this. I would expect you to be able to label each of these structures. And then again, you should know what's going on in each one of those stratum layers. Stratum corneum, stratum lucidum, stratum granulosum, spinosum, and germintivum. Germintivum has significant amount of activity, should be familiar with that. Then the basal lamina and the dermis. This is just a slide that illustrates the melanocytes. I certainly may ask you to identify the melanocytes. There was a picture earlier in the histology slides that showed melanocytes. The hair follicle would expect you to be able to identify the various parts of the hair follicle and the hair shaft itself. Didn't ask you any questions on the sweat glands. And that pretty much covers the material that I'll ask you on the lab portion of the exam. That covers your review, and I hope this has been helpful, and good luck on the exam.